Lovely to meet you. I am Dr. August. So you were here last year for your annual physical.
That's right.
And you're here again for this year's one.
Nice seeing you again, Dr. August.
Lovely to see you too. How are you feeling overall, general health?
All good. I haven't been sleeping that well at night, but other than that, I'm pretty healthy.
Okay. No major illnesses recently, major surgeries, anything that I should be aware of?
No, nothing major.
Okay. Have you been unlucky in catching COVID?
I did a couple of months ago, yes.
And how was that experience?
It was rough for a few days, but after 3-4 days of just being lethargic and with a little bit of a fever, I recovered fully.
Okay. And when did you say you had that?
In 3 months ago.
Okay.
So that would be March.
Okay. Well, I'm glad you've pulled through. Any longer term symptoms that you've experienced? Has the lethargy continued? Headaches? Anything like that?
No, I'm fully recovered now. Thankfully.
Okay.
Yes.
Okay. So let's just get some basic information first, just to make sure we are all up to date.
Sure.
Okay. Is your mobile number still the same as it was last time?
Yep, that's correct.
I think it's ending in 546.
That's right, yeah.
Are you still at the same address?
Yes, same address.
And your emergency contact, is that still your partner?
Yep, still my husband.
Okay. Alright. Have you been offered to go on the organ donor register?
Yes, I am on the
You
list.
are?
Yes.
And what about giving blood? Is that something you'd be interested in doing?
Yeah, absolutely.
Okay. I don't think you have any diseases or conditions as to why you can't give blood, so
No,
perfect.
nothing prohibitive, yeah.
Is there any chance you could be pregnant at the moment?
No, 0 chance.
Okay. And are you up to date with all of your cancer screenings, cervical, breast? You've had those done regularly?
Yes, I think so.
Okay. Okay. So you've brought me your urine sample, which I'm going to test in a moment just to see what that tells me about you. And we're also going to test your blood type because we don't actually have that on the system, and that's something we do need to record, okay, just in case.
Wonderful.
Any differences in your smoking status?
Still not a smoker.
And alcohol intake, it's got you down as 1 per week?
At most, yes.
Okay. And what's your job at the moment?
I work for a tech company as a software engineer.
So lots of computer-based work?
9 to 5, yes.
Okay. And have you taken up any new hobbies or anything that might be challenging you physically at the moment?
Nothing that's challenging physically, but I do enjoy watching ASMR videos and making ASMR content, so that's a new hobby.
Ah, what's ASMR?
It's a way of relaxation.
Okay. That's very interesting. I can search this on...
Yeah, on YouTube, absolutely.
Okay, just make a note of that. Is it... what does it stand for?
It stands for Autonomous Meridian Response.
Okay, very interesting. I will take a look at that. So that's great that helps you relax.
Oh yeah, absolutely.
Okay. And any other stresses or anything at the moment?
Other than not being able to sleep very well at night.
And how long has that been going on for?
A couple of months.
Are you getting any sleep at all?
A few hours usually.
Okay, I'm very sorry about that. Okay. Right, I think I've got all of the questions. we'll do the basic tests, and then we're going to move on to your vital signs. Then we're going to do an extremities exam on your arms and legs, an abdominal exam, and a neurological exam as well.
Okay. Sounds wonderful. Thank you.
Right, so okay, just going to Alright, we're just going to let that work for a few moments. Now, with the blood test, it's going to be a slight finger prick, alright? I'll do it very quickly, it shouldn't hurt. Is that going to be okay?
Yeah, sure.
Okay, let's have a look. Okay, just a short. Okay. And if I could just get you to just. Okay, just give that a wipe for you.
Thank you.
Okay. Okay. So the controls come out well. Okay, you are a O negative.
That's right, yeah.
Perfect. All right, so we'll have this on the system now, just in case, you know, you ever need blood or anything like that, and also it will help us when you're giving blood. Let's have a look at this. So, low levels of leukocytes, low levels of nitrate. Okay, low levels of protein. pH is, let's say, slightly acidic. There is a very normal amount of blood. Okay, very well hydrated.
I do drink a lot of water. Yeah.
Good. Low levels of ketones. Glucose is normal. Okay.
I'm surprised about that. I eat a lot of chocolate usually.
Okay. Well, it's fairly early in the morning, so it may be that your body's just kind of digested that overnight.
Could be,
Okay.
yeah.
Alright, so now I'm going to just ask you to lay back and we'll start with the vital signs. Okay.
Wonderful.
Okay, so I'm going to first focus on your cardiovascular system. So I'm going to have a little listen first to your heart, if that's okay.
Yes.
Right. Any problems or anything you've noticed with your heart?
No.
Okay, very nice strong heartbeat. A good regular pulse, good regular beat. No irregular irregularities there. Okay, while I'm down here, I'll have a listen to the lungs. So let's go to your left one. If you could take a nice deep breath in Nice clear airways. No fluid build-up or mucus build-up on that side. And another nice deep breath. That's great. Lovely and clear, nice, strong and healthy airways. I'm just going to have a listen. Just here, another deep breath in. And relax. That's great. Sounds really healthy. Just stay lying there. I'm just going to pop this on the back there. So another deep breath in. And on this side again, nice deep breath. Wonderful. Lovely and healthy there. So that is great. Let's check your pulse. Thank you. So if you just rest your hand there while that happens. Whilst that's going on, I'm just going to check your pupil response. Fairly bright light. Okay, great pupil response there. Just going to have a look at the colour of your skin. I'm checking for anything abnormal colour, any blue or greys. Just going to look at the eyes. Great pink colours. Have a look at your gum if that's okay. Perfect. No obvious lesions or anything that looks worrying. Okay. Okay, let's have a look. Perfect. 84 beats per minute and a 98% oxygen. It's healthy and normal. Just gonna have okay. Perfect. Perfect. No signs of infection there. I'm just going to have a look at the blood flow on the surface of the skin, and I'm just checking for how quickly the blood flows back. And this would suggest anemia, lack of blood in the body. Okay, let's just try this on your hands. Perfect, just relax there. Alright, I'm just going to now do your blood pressure, okay? So if you could just pop your arm through there. And then just relax the arm. If you could just lift your arm up again, sorry, just adjust that slightly. Okay, and relax. Perfect, lovely and healthy. Well done. Okay, just take this off. Okay. I'm just going to have a listen to your pulse now. If I can just get you to just rest your arm on my shoulder. Okay. Slow that to heart level. Okay. I'm just going to have a listen here. Great pulse. Just feeling the lymph nodes and the glands. Okay, alright. Now I'm going to perform a skin exam, okay, just to make sure that you're not developing any skin conditions that could be an underlying symptom of something slightly worse, but let's hope not. Okay, so just relax there. Okay, what I'm going to be doing now is just checking the moisture levels on your face, neck and arms. Okay. You okay?
Yeah.
Okay. Right, now I'm just going to have a closer look at the skin. I'm just going to come around on the other side of you there. Okay. Okay. Please feel free to close your eyes for this. Some moles on the face there. More on the right hand side than the left. Could be. Would you say you drove more or sat as a passenger more often?
I'm a passenger usually, yeah.
So that means you're sitting on the right hand side?
That's right, yeah.
Okay. There are signs of more sun damage on this side. Do you wear an SPF?
Sometimes when I remember to.
Okay.
Doesn't happen very often though.
I would recommend an SPF. I might also recommend a deep pore cleanse. You've got very clear skin, however, there are some signs of a build-up. So I'd recommend a good facial.
Yes.
Okay. Alright, so I'm just going to lift the gown to expose your stomach, okay? Just let me know if you feel any pain or anything. Any issues with your digestion at all?
No, not that I can think of.
Alright, let's have a look at your arms. So. Just feeling on the joint. That's okay, it all feels good. Good movement in the joints. Any pain when I was doing any of that?
No.
Alright, we'll come back to the shoulders. And now I'm just going to move on to the legs. Okay.
Thank you.
Okay. Happy for me to just lift your trouser leg so I can just see the knee. Any pain here?
No.
Okay. Just relax there. Pain on this side?
No.
Okay. Pain on the ankles there?
No.
Just going to. Any pain?
No.
Pain there?
Mm-mm.
Pain?
Mm-mm.
Pain?
No.
Okay, just relax. Okay, good colour distribution. Just gonna have a look with my light. No unusual moles. Good colour distribution. Again, no signs of inflammation, lesions, or any joint disorders. Toenails look healthy, no signs of chronic infection or fungal infection. Signs of healthy feet, joints. Okay. Okay. You can feel this.
Yes.
And this.
Yes.
And this.
Yes.
And this.
Yes.
And sensations under the soles of the feet. You can feel everything.
Yes.
You can feel me touching your toes there.
Yes.
And on this side.
Yes.
Okay, perfect. Alright, so I'm just gonna come round and we can do the neurological exam now. Okay. Alright, now I'm going to focus on your joints before we move on to the neurological exam. I'm just going to focus on your shoulders, elbows, wrists, and knees. Okay? So, just going to have a feel. Just really feeling for any clicking, anything that feels out of place. Just looking at your posture there. Slightly rounding of the shoulders. Could you just push your shoulders back? Does that feel comfortable?
Maybe my spine hurts.
Okay. Alright, I'm trying to just create a reflex here. Okay, and again. Perfect. Alright, and the reflex. Perfect. Just get your knees. Okay. Perfect. Any pain?
No.
Pain there?
No. No. No pain. Oh, good. Good.
Okay. I'll just get you to put both arms out in front of you. Any pain?
No.
And just place them above your head like this. Any pain there?
No.
Can you tip your head back? And forwards. And just relax the arms. Okay, and now again to the side, the other side. Okay, head back and forwards. And if you could shrug your shoulders and relax. And just circular motions. Any pain there at all?
No.
Okay, I'm just going to feel on the rib cage. Any pain here? Any pain first thing in the morning when moving joints?
No. No pain.
Just feeling on the joint of the jaw. Any clicking?
No.
I need to open your mouth and close. And again, and close. Okay. Just feeling on the cranial bones now. On the nose. Okay. All right. I'm going to move on to a neurological exam now. Okay. Any history of Bell's palsy in the family?
No.
Multiple sclerosis? No. Any kind of neurological conditions? Okay. I'm just going to do some tests now on the face. Just keep the head nice and still. Okay, I'm just going to ask you if you can feel this.
Yes.
Yeah.
Yes. 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 Mm-hmm. Yes. Yes. Yeah. Yes.
Yep.
Mm-hmm.
Okay, I'm just going to brush you in different areas similar to the last test. Just let me know if you cannot feel it anywhere. So I'm going to do a continuous line across the face, and if at any point you lose the sensation, just let me know. Any loss of sensation there?
No.
Okay. I'm just going to try and trigger some reflexes on the face, so please close your eyes. Alright, this might trigger you to twitch slightly. Okay. Okay, and open the eyes. And how is your vision? You can see okay?
Yes.
Yeah, how many fingers am I holding up?
2, 1, 5.
Perfect, okay. Can you hear that?
Yes.
And that?
Yes.
Okay. Any hearing loss at all? You can hear that consistently?
Yes.
And on the other side?
Yes.
Okay. Can you hear the difference between this and this?
Yes.
Okay, perfect. Alright, if you could just shrug. Alright, hands out like this. I'm going to try and close. If you could point to your nose for me, your right ear, your left eye. Perfect. If you could just copy what I'm doing. Okay, relax the mouth. Smile, frown. Okay, perfect. Okay. So there's no tingling, there's no kind of numbness or any loss of sensation. Now in regards to the sleep, how long did you say this had been going on for?
My whole life.
Your whole life, okay. And do you suffer with depression, anxiety?
Oh, no depression.
Any kind of stress that you have to deal with?
Maybe my job sometimes can get a little stressful, yeah.
Okay, what I would recommend is, I'd recommend forwarding you to a sleep specialist. Now a sleep specialist will be able to help you create a better sleep routine and sleep hygiene. Now what I mean by sleep hygiene is things like removing TVs from the bedroom, only going to bed when you're tired, kind of creating habits, healthy habits that will allow you to improve your sleep condition, okay?
Yes.
But from the kind of physical medical side of things, I'm happy to report that you are very healthy and I don't have any concerns. So what I will do is again repeat this for next year as part of your package with your health insurance.
Thank you so much, Dr. August.
No worries at all, and hopefully I won't see you soon, but if so, I'll see you in a year.
Sounds good.
Alright. Okay, take care.